My name's Amy Newstrom and I'm a nurse practitioner at Manlove Psychiatric group. I've been here for about 5 years.
And what's your main role here?
I prescribe medications and I help with TMS, and then I also do some counseling services. So a little bit of everything.
Do you refer patients for TMS as a nurse practitioner? Or can
I
you?
do.
Okay,
Yeah.
cool.
Yep.
Have you ever tried it yourself?
Well, I've had pulses like for when we're checking and learning about how to find somebody's motor threshold. I've never had a full treatment myself.
And what has been your experience with TMS in general over the years as you've how long? First of all, how long have you worked with TMS?
I think it's been like a little over 3 years that we've been doing it.
Okay.
So.
And what has your experience been with your patients who you have referred TMS for?
Mostly positive.
Okay.
I haven't had any negative experiences other than no reaction or minimal improvement. But that's not been statistically. I don't know what that is. It's a small amount of people. If it was a large amount, I wouldn't keep sending them for TMS. But
What, in your mind, makes somebody a candidate for TMS and somebody who you would refer for TMS? Is there some characteristic or quality about a person that you look for before you say this person would be a good fit for TMS?
So the process that we do here is we check their Montgomery-Åsberg depression scale, and they have to be in the severe range. Then we record all the medications they've ever tried, and they've usually been on a significant amount of medication and not had positive results or minimal results. So I definitely look for that, at least 4 medication failures. Most people easily meet that criteria. And then also that they have the ability to drive in and out every day. They live in the area. They don't have any implanted devices, all of the TMS safety questionnaires. So I think about the people that I have mostly referred have been very severe cases where I'm beginning to have concerns that they are losing hope. And they have tried lots of medicines, they've had side effects, they don't feel good, and they really do want to get better, and continuing medication trials is just not in them. And so I think TMS is a really nice, really relatively safe thing for them to try. And so I've had some of those clients do really, really well.
Do you have any stories about clients that stick out to you? Obviously, we don't need any details, but was there any client in particular or any case in particular that you found interesting or surprising in some way where TMS was also involved?
Sometimes it's surprising how fast people start to get better, and that's great to see. They're hesitant, they're scared, and once they know that it's not going to be painful and it's not going to make them feel different or they're going to have these major side effects, they're kind of excited. And so it's nice to see them getting better. Some of them, like I said, within a couple weeks start to feel some improvement. And that's very encouraging when they haven't felt that on medicine before.
Is there a particular case that stands out on your mind?
Well, there's a couple. I mean, we've had a lot of really great successes. I think that's because we do a lot of combination. We do an organic workup, genetic testing, and then we also change medications and also do TMS. So it's really this kind of package thing. And then Mandy's working on them with, some didactic throughout their TMS treatment about how to get better and how to have coping skills and a healthier lifestyle. So I think that whole package is helpful. But there have been people that have lost their passion for their for whatever, playing music or writing or whatever it is, and they find that again, and it's just a really neat thing to see. So,
about approximately, ballpark figure, what is the usual amount of sessions that you would refer a patient, someone who is severely depressed? How many sessions would you usually refer that person for?
30. Well, 30 plus is it 6 or 12 weeks of follow-up, so it's just the standard protocols.
Okay.
So 5 days a week for 6 weeks, plus once a week for 6 more weeks.